2019 Educational Webinar Series. I'm Catherine Short, Partnership Marketing Manager for First Healthcare Compliance. At First Healthcare Compliance, we help you with a comprehensive compliance management solution tailored to your business. A hospital, hospital network, healthcare practice of any size, billing company, or skilled nursing facility. As part of our complimentary educational webinar series, we bring you experts from around the country to discuss relevant topics in the healthcare industry. We are so pleased to have Shivhon Adkins, the founder of Medical Receptionist Network, with us today. She is also the practice manager for Advocare Newborn Network. Shivhon has over 16 years of experience in healthcare and front desk operations. Her previous experience as an office manager provided the opportunity to directly manage and develop employee and patient relationships. Shivhon also improved daily processes within the office setting by creating and enforcing policies, procedures, and creating a new employee recognition program for the organization while overseeing a multi-office practice. Shivhon is the author of Medical Receptionist Handbook to Success and has had articles published in the PACOM Journal. She also hosts a podcast show for medical receptionists and healthcare administrative professionals. Shivhon began her college education at Bennett College in Greensboro, North Carolina, and DeVry University in North Brunswick, New Jersey, and went on to earn her Master of Public Administration with a concentration in Health Services Management from Keller Graduate School of Management. Shivhon has been an active member of PACOM Delco chapter since 2015. A copy of the slides is available for download on the control panel. Feel free to submit questions into the question box on your control panel during the presentation. We will address questions at the conclusion of the presentation. Your PACOM and PMI CEU certificates will be emailed to you following the broadcast. Your PACOM certificate will come directly from PACOM, and your PMI certificate will come from our email. There's no need to request either one. Additional CEU opportunities will be available to BC Advantage members following the live broadcast. See their website for details. A download of the handout is available with a button on the bottom right-hand side of your screen. So without further ado, welcome, Shivhon.
Hi, Catherine. Thank you so much for that wonderful introduction. So happy to be here today. We are going to jump right into front desk success with Medical Receptionist Engagement. Today, we're going to discuss quite a few different areas that have to do with our front desk, starting with workflows and processes that work for your front desk, creating and communicating realistic expectations of medical receptionists, expanding roles at the front desk, improving low morale and job complacency, addressing interoffice conflict head-on, and communication behind the desk. Patient interaction and customer service, along with the 360 view and meeting differently, and supporting your front line. Front desk operations has always been very important to me. I started my career as a medical receptionist, and having the opportunity to work with many medical receptionists over the years, I have found that concentrating on our front line is extremely important to our overall operation. So we're going to get started today with workflows, the importance of front desk workflows. In order to have an operation that works very well for your office, you have to make sure that everyone knows exactly what they need to do in various situations that may occur at the front desk. So having workflows that are up to date and very organized is very helpful to your front desk. For instance, if there is a specific way that check-in must be processed, having bullet points for your front desk to have access to and reference is very important. Now, it may not only be with your systems, but perhaps it's how calls are responded to, how pharmaceutical reps are addressed. Having workflows for anything that your front desk does is very helpful to them as a reference point, and it helps them not to interrupt each other to ask questions, and also take some of the weight off of you of having people always coming to you for things that they should already have access to, to that information. So the consistency across the board is very important. So when you have things in writing, you're going to have consistency amongst your medical receptionist and your front desk, because they're all referencing the same information and they know how to deal with each situation the same way. Obviously, there are going to be times when you have to stray away from your general workflow, but for the most part, you want to make sure that specific steps are taken to get to the end results. And you also want to follow up with your staff regarding your workflows. You want to make sure that they're working and that your staff is able to execute them the way that you have intended for them to be completed. And when are they needed most? A lot of times we think that, oh, the things that we do every day is where we're going to need them the most. You want to have those in place. However, when we do something every day, we tend to remember those the most. So you want to look at the things that only happen every now and again, so that you can create workflows for that as well. So perhaps you have, maybe twice a month, someone walks in your office that doesn't have an appointment, or they're upset over a billing issue, but again, they're walking in the office, they don't have an appointment, they didn't set up any type of meeting, and you want to make sure your staff knows what to do in that situation. So having a workflow for that, having a reference sheet for that, having directions for that is very important. And then we can go into best ways to incorporate new workflows and processes. So depending on what the workflow is and how elaborate it is going to determine how you're going to transfer this information to your staff. A lot of times, if you have something going on with your electronic system or your computers, perhaps you want to make sure that there are screenshots and that there is a demonstration of this, and that you work with them directly so that that they understand exactly what the new process is. If it's something that has to do with taking a phone encounter, maybe it's more simple and something that you can send in a memo, that you can send in a message, or just hand them a sheet. But some things do require that hands-on training, and you want to make sure that you're a part of that. And if you're unable to be there all the time, you want to have a point person at your front desk who can take on that responsibility and who has the thorough training to assist your other staff when it's needed. And you want to make sure you're reinforcing your current workflows and processes, and making sure that your staff is doing the things the way they were meant to be done, and not taking shortcuts, not forgetting things. And when you're following up with them, it's easier to pinpoint where maybe people are falling short, or maybe someone's doing it really well, or maybe they've added something and that's something that you need to incorporate into the workflow or the reference sheet, so that your whole staff has access to that. Managing expectations. So you want to be very clear with your requests for your front desk medical receptionist. You want to make sure that if you ask someone to complete a task, that they have very specific instructions, that it's put in writing or it's documented somewhere. You're providing time frames. For instance, if someone is responsible for medical records or completing letters, that your office has a standard and that your staff is very aware of what that standard is. So if we're going to complete things within 24 hours, then it has to be completed within 24 hours. If it's a week, it's a week. But they have to know this information, because not only are they able to manage their time, they're also able to convey that information to the patients as they request this information. So that's very important with timeframes and being very clear and specific. And you want to follow up regarding specific tasks. So if you have some of your front desk responsible for other areas outside of the typical check-in, check-out, answering of phones, and maybe they are responsible for, again, letters or disability forms, or they have to, put together any type of report, you want to follow up with them, making sure they have enough time to do this, that they're using their time wisely, that the workflow that you have in place is, again, working for that particular task. And provide resources to increase efficiency. Again, so that's going to be any resources or reference sheets, any examples of why something needs to be done, just to help them understand why it's important, why they're doing it every day or every week, and that will help your staff be able to do their job and be confident in what they're doing and why they're doing it. And then again, you want to obtain feedback from your front desk. as often as possible, just checking in with them. It doesn't always have to be about a meeting, but just checking in with them, making sure things are going well and that the tasks that they have been assigned are reasonable for them, and that they have enough time to do it, they have enough assistance, they have enough backup at the front desk, and managing the expectations. So we're also going to discuss expanding roles at the front desk. I always think that encouraging independence and leadership is very important to have a nicely oiled machine. You're not able to be at the front desk all the time with your staff. You're not always able to be, available by phone. So you want to make sure that they have all the resources they need and that they can work independently and that they feel safe enough and confident enough in their abilities and their skills to do the job, without constantly having to reach out to you or constantly having to ask, other leadership for guidance. I think that it should be reserved for, specific situations or, situations that are out of the ordinary, but you want to make sure that you encourage them to complete tasks. And the more information they have that allows them to be independent and to, whether, they're not a manager, maybe they're not a supervisor, but they can have that leadership role at the front desk. This is their area. This is where they are every day. They're managing your front desk, dealing with every patient that walks in the door. They're also responsible for making sure your waiting area is being managed properly. So, they should be encouraged to have a level of independence so they take pride in what they're doing. And you also want to delegate with clarity. And at the front desk, you may have, someone who takes on a leadership role. And if you can support them with that and allow them to have a little more say in how things run, then that's great. If you can't, make sure you're delegating with clarity. For instance, if you have an area of the front desk that's just a bit of a mess and you come up front and you say, you know what, this needs to be cleaned up by the end of the day, or these supplies need to be put away by the end of the day, and you walk away and there are 5 people there that have to make the decision. If you say, if you are more clear and say, assign it to 2 people and make sure they get it done by the end of the day, you're just cutting out the question of who should do this, when is it going to happen, and that way, when the other 3 staff members realize that these 2 people took 15 minutes away, they know why. It's because you came up and said and assigned this task to them. So just a little bit of clarity will help, there not be any animosity or tension as to who should be responsible for certain tasks. Cross-train to benefit your practice. I have always been supportive of cross-training. I know it's often difficult to train everyone to do everything, but when you have long-term staff, you tend to run into an issue where, not even an issue, but it's great. You have people who've been there a long time. They take on bigger responsibilities. They get them done. They know how to do it. The newer people, maybe they're just focused on the main front desk responsibilities and, managing the patients as they're coming in and leaving and things like that. But you always want to be prepared for when perhaps the person who is more of a veteran and they're more skilled and more trained, if they're not there, how are you going to survive? You don't want to put yourself in a desperate situation. So you want to make sure that there are more than one person who know how to do, maybe they're calling on referrals or, initiating a pre-authorization or, completing medical record requests. So you want to make sure that you take the opportunity once people are trained on their basic responsibilities, that they have an opportunity to learn something new. And that lets people also feel good because they know that, oh, you know what, I can actually step in and help and do a little bit more. I'm valuable to this organization because I know how to do X, Y, and Z. And it helps you in case there's an emergency, someone's sick, someone retires, someone leaves. You're not in such a stressful situation because you at least have people who can pick up some of the slack until you're able to find a replacement and restaff your front desk. So acknowledging employee strengths and creativity. I find that When we acknowledge the strengths and creativity of our staff, it allows them to put a little bit more of an investment in their position, and they feel more comfortable at work, and they feel more again valuable, and that they can display other strengths that they have that don't have to do with them typing 80 words per minute. So if there are other special events or things that your staff can be a part of, I would definitely make sure you're involving them and seeing if that is of interest to them. It may help take some things off of your plate, and also allowing your staff to be involved at a greater level. They're there every day, they're putting in their time, they spend a lot of time with your patients. If you trust them with that, you can trust them with some other special activities, and using their feedback and their input to make the office run better. Encourage communication between clerical and clinical departments. Just make sure that all of your staff at your front desk know what modes of communication are acceptable between themselves and your clinical departments, what information they need when they are communicating with the clinical department, if they're should be putting things in writing, if they should be using interoffice messaging, emails, or what situations would warrant them to be able to knock on a physician's door to bring them out of a room, or to get a nurse. Just having that, and that comes back to those workflows and knowing exactly what I should do in this situation, so that they have a reference point and they're not always looking to you for assistance. And we also want to improve low morale and complacency. There are definitely multiple things that can cause low morale and complacency. So the first thing you want to do is get to the root of the issue. Definitely observing, what's going on. A lot of times as a leader and a manager, an administrator, what's going on. Perhaps there's a merger, or, there's some turnover, and it's just changing, how things feel in the office. So those are certain things that you can kind of feel coming, and you can get ahead of it by avoiding the tough discussions with your staff. Your front desk is, keeping them in the dark doesn't always help things. It kind of makes things worse and adds a little fuel to the fire. So you want to make sure that you're communicating with them and being upfront as much as you can. If you know there are changes coming, let them know about the changes as much as you can. These are people too. They have families, they have responsibilities. They want to make sure that they know what's happening in the workplace instead of coming in every day with uncertainty. So keeping people up to date and aware of what's happening allows them to feel at least some level of security. Obviously, you may not have all the answers. You may not know exactly what's going to happen in the next 6 months, but if you know what's going to happen in the next 60 days, why not make them aware of that? Use other ways to obtain feedback outside of meetings. Something simple as a suggestion box. You can get things anonymously that way, or making sure that your staff knows how they can communicate with you about something that comes up that may not directly be related to a patient. Maybe it's just related to some situation that's going on, with your front desk staff, or between your staff and other departments and things like that. So just make sure they know how to communicate with you, and that you encourage that they do so. Address all concerns, even if you're unable to give your staff the answer they want to hear. If there's something swirling around and you kind of, there's chatter about it, you want to kind of control that. So you want to make sure that you have the conversations. I know everyone's worried about this. The only information I have to provide to you is X, Y, and Z, and you go from there. And, then you give them a clear time of, we'll follow up again next month, or, in a couple of weeks as I receive more information. So that way they know that you understand that they are worried, they have concerns, and you're also, making them important in this process. And you also want to encourage the teamwork to balance workload. Cross-training is important to this as well, because the more, the more people know different responsibilities, they can work even more as a team. But when it comes to just your basic everyday activities, if I'm helping someone at the front desk, but right before they walked up, I had to put someone on hold, and there is another receptionist sitting next to me who's not, maybe doesn't have anyone on hold, doesn't have a patient in front of them, and they never pick up the call, to help me out or say, let me take this patient so you can finish your call. Those are the kind of things that you should be looking for, just to make sure that people are helping each other and working as a team, so that now the person on hold doesn't have to wait and the person in front of me doesn't have to wait. And while this seems like common sense, oftentimes everyone does not work that way. So you have to kind of be the one to encourage that and to explain why that is important and to enforce that as well. And incorporating team building activities is very helpful to do a couple times a year as you're able to do that. Encourage personal growth. Sometimes with medical receptionists, there are a couple different scenarios. Some people want to do healthcare administration. They want to remain in that position. They want to grow in that position. Other people have other goals, and maybe they want to go back to school and do things like that. If you're able to encourage that or be supportive of your staff as they're doing that, whether it has to deal with schedule changes or generally it's going to be a schedule change, because if someone wants to go to school, they need some time. But just anything that they're interested in, they've shared it with you, or something that's going to affect their position. Just trying to be supportive as much as you can without it really having a great impact on your office production and your operation. And there are ways to do that. I've had to do it. I've needed it done for myself at times, and there are ways to do it. And I don't always think our first answer should be no. So whenever you can, because those people, once they see that you're willing to help, they may stay around a lot longer to work with your practice and to be a part of the group, because they know that you care. And so whenever possible, it's great to be a part of that, and you see your staff grow, and you see a lot of growth in their professional career. Celebrating awareness months related to your specialty. That's also another way to get staff involved. You can, if you're organizing walks, you're having fundraisers, maybe a couple times a year, you're doing things like that. You don't have to always be the one to organize this in full. Ask your front desk staff if they want to, be the one to put it together, choose the date, prepare the announcements, share the information with your patients. That's a way to involve your staff. Let them show some of their creative, ability. And also including them in decision making when possible. And that more so has to do with things that are specific to the front desk. If you're changing a process because something new came from your billing department, and you sit in your office and you write up this new workflow, and you haven't even asked your front desk staff how it's going to affect them, or what else they would need to have this communication with a patient or receive this information from a patient, it's oftentimes you're going to find that there's holes in that. So as much as you can discuss with your front desk staff before, for things that are going to affect them directly, I would definitely do that, because they often have great ideas. But if they feel like their ideas are not going to ever be incorporated, then they're going to stop sharing them. So you want to make sure that whenever possible, you can include them on the decision making. Complete an overall review of the year or the quarter, so you can highlight any milestones, changes, patient reviews, or improvements with your staff. I think that's an awesome way to share, highlights that your staff may not normally be aware of. These are things that you may have to notify your physician management about, but why not share patient reviews with your staff? Why not share great milestones that, if you increased how many patients you were able to see, or you increased how many positive outcomes you had for, the type of population that you treat? Why not let them know that? It allows them to feel more a part of the practice, and they know, where their energy is going, and is helping to be a part of these wonderful things that your office has accomplished. So addressing inter-office conflict. You definitely want to observe when it comes to inter-office conflict. Internal conflicts are generally caused by a lack of communication or poor communication among staff members. So finding out where the breakdown is stemming from will allow you to address the issue more effectively. A lot of times we hear about things from, maybe one staff member comes and they let you know about a situation, and then immediately you go to address that. But if it's something that's affecting more than just one person, you don't want to let the elephant linger in the room. You want to address the issue as soon as possible. You want to definitely not assume. You want to ask questions. You want to speak with the people involved and make sure that they are aware that it's important to come to you with certain issues before they start to, talk about it with other people who cannot solve the issue. And usually that happens when employees are just become disgruntled for whatever reason. And you want to always make sure that your staff has that one-on-one opportunity to speak with you. And when there is an issue, when they see that you're addressing it fairly and professionally, then hopefully the next time it will not get out of hand before you're able to address it. And I'm a supporter of, if there are just two people who are having a conflict, to have them in the same room and have those discussions. It often comes down to miscommunication and can be resolved. Incorporate or reinforce communication preferences between departments. We touched on that earlier. You want to make sure that, perhaps your billing department prefers to get information one way, but your clinical department wants to get it a different way, just because of the patient's, privacy. So maybe you have to make sure that your staff is aware of that, so they're not sending the same type of communication they send to the billing department to your clinical department, and also making sure that those departments are aware of how your staff has been instructed to do that, so that they know that your staff is doing things the right way and the way that they've been informed to do so. When there is an issue beyond the front desk and there are other managers or supervisors that can help enforce positive communication, include them in your efforts. And again, this is kind of a lead by example. When your staff sees that you are supportive of what other managers and other supervisors are enforcing, and also you are supportive of their decisions regarding their departments. So if it's your lab or your radiology department, or your clinical, your nursing and medical assistants, then they will know that they can't pull one over, and that everyone is supporting each other because you all have the same goal. So if there's an issue that has to do with your the way that you're maybe a medical receptionist addressed a clinical person, then perhaps you and the clinical manager should address that together and let them know why, this is an issue, and it's not so much one against the others. We're coming together. We're going to resolve this, so that everybody knows exactly how to move forward the next time. Patient interaction and customer service. So quality care starts at the front desk. I think the front desk has a great advantage to set the tone for appointments, set the tone for how a patient will feel about your office, especially a new patient. When they're answering the phone, how are they greeting your patients? If there's a specific greeting that you want to be used, make sure that they are doing that on a consistent basis. Make sure people are taking messages effectively. And, taking a message seems like a simple thing. And you can say, oh, your workflow may say, answer the phone, take the message, take a message that includes reason for the call. Reason for the call could be medication. Someone can just write medication, but someone else may say, patient needs refill of Zoloft, 10 milligrams, 30-day supply. That way, the information is more specific. So once this message gets back to your nurse, they can look in the chart, make sure that that's what the patient is taking. But if the patient's on 10 medications and I write a message and say medication refill and give it to the nurse, what happens then? The nurse now has to call the patient back before they can even update, make any changes or make the call to the pharmacy. If the nurse is calling back, you want the call to be, hi, I received your message. We've refilled your medication. If you have any other questions, please give us a call. And that, shuts down that extra call in between. So effective message taking is important to customer service, because the patient, when they get that call back, they're just being notified that their prescription has been completed, right? So they made one call to the front desk and went from the front desk to the nurse, and it was resolved. Welcoming welcoming your patients into your office. How is that being done? Is everyone being addressed when they walk in? Oftentimes, you can walk into a place and you stand there for 5 minutes and no one has addressed you. And that's not only in healthcare, that's in different industries, but we should not have that. Should not be standard in healthcare. If I walk into a medical office, I expect that someone's going to acknowledge me. So if someone's on the phone, your staff should know they could at least look up, make eye contact with the patient, or use a hand gesture. Ask them to please have a seat or sign in. People need instruction. They need to know what to do when they come in. So you want to make sure that your patients are being welcomed in a manner that is whatever the standard you want to have perceived for your office. Obtaining information and patient privacy, making sure that your staff is being mindful of patient privacy. And we know that there's restrictions based on HIPAA, but you also want to make sure that something general, you've walk into a medical office and the person sitting at the desk will say, "What are you here for today?" Now, if there's someone standing next to me or behind me, maybe I don't want to tell you what I'm here for today. Now, with a lot of the systems that we're working with, if you're using an electronic system, or even if you're still on a paper system, the patient called to make an appointment, which means that information is probably already in there. So they should not be asking that question unless there's a very specific reason why you need to know that, or maybe they can have a piece of paper where they can write that information down. Because, some patients, instead of having someone feel uncomfortable or feeling put on the spot that they have to answer that question, you just want to make sure you have things in place to where the patient is able to either not have to answer that question, where your staff is not asking questions that should be either written down or asked in private. Also want to make sure that your staff is showing empathy, patience, and paying attention. So empathy is not always natural, doesn't come natural from everyone. So sometimes, some people have a different nature about them, a different attitude, and you just want to make sure that your staff is aware of what is expected of them, depending on the type of patient population that you're dealing with, and make sure it falls in line with what is required and what is healthy and, best for your patients. And when I say having patience, patience as far as patients coming in, they're filling out paperwork. Some people are slower than others. Some people have issues seeing. Some people have issues writing. Some patients, may have a disability or need assistance. So you want to make sure that your medical receptionists have the patience to handle these situations. And even with all your patients, or on the phone, if someone is longer winded, they have to find a way to be able to communicate with these people without being rude or cutting them off, and just finding a way and making and it's really your job to make sure that they know how to do that, and that they are treating your patients with the most respect, and paying attention to them, listening to the patients, making sure that they are not assuming what someone is trying to tell them, and actually listen and pay attention to what the patient is actually saying. Keeping patients in the waiting room informed. This is very important. Everyone's time is very valuable. Our patients have other appointments, just like we have, important things going on. So it's always important to let your patients know that there's a wait, and that should be coming from your medical receptionist, keeping them up to date as best as possible. Even walking out into the waiting room is very helpful. You can kind of walk out, let them know, hey, we are behind, I'll follow back up with you in 20 minutes, different things like that. Or if they know that the doctor or the nurse or whatever department is behind, they can let the patient know as they check in. That way the patient can make their own decision as to whether they're going to wait, whether they want to reschedule, whether they need to leave and come back, or whatever the case may be. So your front desk and waiting area. Organization is key to a successful front desk operation. Forms, supplies, in and out boxes. You want to make sure that all the forms that you have are neat and you have clean copies, that your supplies are stocked, and that your staff isn't running out of things and having to run around and look for stuff, because that just takes time away. In and out boxes, you want to make sure where things go is clearly designated. If you have physicians coming up bringing things to the front desk and they're just dropping them down, that's how things get lost, or maybe your medical receptionist will overlook something that needed to go to a patient. So you just want to have kind of designated areas where everyone in the office knows where things go. Your printers, scanners, fax machines, make sure they're in, good working order. When someone has to stop what they're doing because the printer is jamming every time someone prints more than 5 pages, you want to make sure these things are getting repaired, making sure they're in working order, because that's a hindrance to your front desk. It becomes frustrating. It slows down the time that they have with your patient. It increases the time that a patient may be waiting for them, or that another office is waiting to receive something if your fax machine is not working, or whatever the case may be. Having clearly marked check-in and check-out areas just comes down to making sure people know where to go on their way in and on their way out. If you have a smaller office, it's not always a huge issue, but sometimes if you have a larger office and you want to make sure people are checking out and that they're not walking right out the door and not, getting what they need, or, receiving their next appointment and things like that. So having those areas clearly marked. Any notices, announcements, and instructions, you want to make sure that they are up to date. Notices sometimes can have to do with your late policy, your no-show policies, things that you have in your reception area for your patients to see. Any announcements, any changes, if you're changing locations, if you are changing your hours, making sure these announcements are up to date, that they're everywhere, your patients would have access to them, whether it be your website or your reception area. And instructions and pamphlets and patient information. So, oftentimes your office may complete certain surgical procedures, in-office injections, and different things like that. And so we tend to have pamphlets of information. So you always want to make sure that those pamphlets are current and up to date. We kind of tend to purchase things in bulk, but if you only do a procedure twice a month and you've ordered 2,000 of them, they can be out of date. So you want to just make sure you're looking at those things periodically, making sure it's still current, making sure that all the information that you have out for your patients is up to date and current. The 360 view and meeting differently. I think doing a 360 review is extremely important to really get some information that you may not get otherwise. Do you know what your medical receptionists think of your leadership? Do you know how they feel about their coworkers? Finding out where everyone stands allows you to move forward in a more proactive way and tackle the issues. Obtaining information confidentially improves the likelihood of pure honesty. So getting these completing these reviews anonymously is very helpful. And in doing that, your staff can review you. Your staff can also review, your front desk receptionists can review each other. And then when you have all this information, you can look and see where, maybe people are doing really well, or maybe there's a trend about, one person, maybe they need some assistance somewhere or some additional training. And then you can also see where you stand in the eyes of your employees. And I think that's very important for us every now and again to know what where we can perhaps improve, or where we are doing a great job, and make sure we continue to do that. You can also take a different approach to your meetings. Get suggestions and topics from your staff and other management prior to the meeting. I always involve other management, especially if some of the processes that your front desk completes have to do with your billing department, have to do with your clinical department. Are they scheduling certain appointments the right way? Is that affecting how the clinical staff is able to manage, what's going on in the back? Are they getting all the insurance information or social security numbers or things like that for your billing office to follow up beyond the initial claim process. So you want to make sure that you kind of follow up with your other leadership to make sure that there's nothing that needs to be brought to the attention of your staff during your meetings. If there's a new process that's been incorporated between your current meeting, in your last meeting, you want to make sure that you can demonstrate that for them, at least review it, and then using a quiz or a test, a quick questionnaire to make sure that they understand what the change is and that they have retained the information, and also provide a reference sheet so they can add to the rest of their workflows. Use recent examples of recent scenarios to explain why you're discussing certain points. So during meetings, sometimes it ends up being, you're talking about the same things over and over again. So when you're bringing up an issue, you want to kind of support that issue. Why are we talking about this? Because, 2 weeks ago, Mr. Johnson came in the office. He had several different questions that involved his bill, his last appointment, a concern he had about the physician, and it wasn't handled very efficiently. So in the future, if you have this issue, we're going to do X, Y, and Z. So it just helps them connect it to an actual situation as opposed to it being just additional information. And have meetings off-site if possible. Just to have a little bit of a change of scenery. I think that's very helpful. As leadership, administrators, management, we often have the opportunity to do that ourselves. Our staff generally does not. Support your frontline. As managers and administrators, you often have a full plate. Your front desk staff is a part of that, and they look for you for support. So you want to be fair, and whether it's in your disciplinary actions, whether it's in your dispersing of workload, and then privacy. And when I talk about privacy here, I'm talking about the actual privacy between you and your staff. Say someone takes time off, and they have the time. They didn't have to tell you why they're taking that time off, but they confide in you that they're someone in their family is ill or something is going on, but they're speaking to you about that. And I don't think that it should be shared, with other people in the practice if it's not necessary. And so your staff needs to be able to have a certain level of trust with you, and that you're going to be mindful of their own privacy. If not, then I would just make sure that you're not open to those discussions with your staff, because I find that the privacy is very important. When people can confide in you, they are more likely to be very honest when it comes to other things that have to do with the practice and have to do with the office and different actions that take place. But they need to know that they can trust their leadership. And accountability, making sure that you're accountable for anything that you have mentioned to your staff that you were going to do, to help their everyday processes be better. If you've made certain decisions and given them timeframes, make sure you're sticking to that, and also hold them accountable for anything that they are supposed to do, any changes that they were supposed to make. Avoid favoritism, and that comes along with your fairness. Yes, you may have people that have been with you for many, many years. You may have people that are, in your mind, the rock star, but when it comes to how you interact with them at work, it needs to be very fair, and it needs to be fair across the board. Listen to your staff when they have a concern. Do not brush things under the rug. Most of the time, they're going to have a very valid concern. They're at the front desk every day. They see what's coming in and out of the office. They're answering phones. They're doing, they're practicing these different workflows, and they know, many ways that things can be improved, or they know where the issues are. So you should really listen to them and always lead by example. Front desk priorities. So obviously, stellar customer service, payment collection, demographic and insurance data entry, scheduling, and consistency. So you always want to be very supportive to your front desk and very encouraging when it comes to customer service and payment collection, and making sure you're expressing the importance of these tasks, because these are the things that will affect your other departments, will affect your bottom line, will affect how your practice is viewed, outside by your patient population. So you want to make sure that your staff is being very consistent. They're following scheduling procedures, they're entering information and insurance correctly, and that they're asking for payments, and that they're following whatever the protocol is for your office regarding deductibles, co-pays, and self-pay payments, and that they're just providing stellar customer service. And that can be anything from how they're welcoming your patients, how they're following up with your patients. If they have patients that they need to call back, provide information to, the more information that your staff is aware of, and the more knowledgeable they are, the better customer service they can provide, because they're able to answer the questions. They're able to help a patient from beginning to end, within their realm of what the responsibilities are of your medical receptionist. So, today's takeaways. Front desk receptionists require structure. That's very important. Everyone wants to know exactly what they need to do, and they're able to move through their day much easier. They have resources, they have references, and they have you to help them along through their medical receptionist career and responsibilities. Medical receptionists provide a very valuable service to our patients and deserve to be a part of the decision-making process when applicable. So you always want to keep them involved and keep their opinions, held high, and not push their concerns under the rug. You always want to make sure that you include them when you can. An organized front desk can be a very much more productive front desk. I think that goes for all of us. The more organized we are, the quicker we can complete tasks, the better we can access information that we may need for our patients, our physician managers, and things like that. So being organized at the front desk, having your supplies, making sure your printers are working, your keyboards and things are all operational is very important. Providing clear expectation, reduces the chance of conflict and uncertainty. So the clearer you are and the more upfront you are, the better chance you have of having less conflict in your office. There's no uncertainty, there's transparency. Everyone is aware of what is expected of them, how to do it, when to do it, and they know who to go to when they have any questions or concerns. And I will end with medical receptionists are the bridge. They are the bridge between anyone that wants to move through any process in your office, whether it's over the phone or to the front desk. And so it's extremely important that we support them in their role in our offices. Thank you so much.
Thank
Kathy?
you so much, Shivhon. Yes, thank you so much. I appreciate that. It was a really great presentation.
Thank you.
Thank you. Do you have a slide that has your contact information on it?
Absolutely.
Okay, great. Well, we had a few questions come in, so
great.
I didn't know if you had a moment to answer those.
Oh, absolutely.
Okay, so the first one is, how often would you recommend front desk specific meetings?
Okay, so meetings obviously are a great way to get a lot of information to your staff and receive a lot of information from them. Generally, I would say quarterly. If you are checking in with your staff regularly, there should not be a need to officially meet more than that. You figure 90 days provides enough time to have valuable information to discuss, as opposed to just having meetings monthly where everything, everyone can't wait to go home. People are just kind of like, oh, we just had a meeting, but you don't want to waste your time. You don't want to waste your staff's time. And, quarterly, if you think January, April, July, October, in October, you can start discussing things that may be coming up in the next year. In January, also in October, any insurance changes. So you kind of have to look at it that way, and you kind of can also prepare yourself across those 3 months. So it may not only be processes and workflows that are changing, but there may be some other things that you want to discuss. And holidays are coming up, vacation time, things like that. So when you have them scheduled in advance, you can look ahead and discuss any dates, specific concerns, the weather and anything of that nature, depending on where you are. So I would definitely say quarterly is a good standard.
Great. Yeah, you don't want to tire everybody out with too many meetings, but that sounds like a good standard.
Right.
Okay.
Thank you.
Sure. Another one is what team building activities do you recommend? You said you had mentioned team building activities. So what do you recommend that can be done on site?
Okay, so on-site, and I always try to give information for on-site because everyone, can't go to do, things outside like the escape rooms and,
Right.
bowling and things like that. So one thing I would say is, you can do office trivia, especially if you have a smaller group. You can, do role playing where one receptionist can be the patient and the other responds to the patient as the receptionist. You can create patient profiles and the employees, can choose one. And then it allows for you to have a little discussion on how they handled the situation. And you can have different profiles of, the patient, of maybe why they're coming in, their age, their name, if they're late or not, and just create that kind of profile. But I think that also takes, you have to have people who are willing to participate in something like that. Another thing that I would say is a scenario-based game where you're basically creating cards with specific office situations. So say we let the staff create 1 to 4 steps on how to handle the situation, right? Then you pair them up and they must collaborate to create another set of steps to resolve the issue. So this will mean, that they have to agree on the same steps. So again, we're team building. So now they're forced to create one solution. And then, depending on how many staff members you have, you can keep joining teams until you're kind of down to 2 teams. And I would suggest using a timer. That's very helpful. And, when you have your final 2 resolutions, you can have your staff individually vote on the best solution. And then you, as a leader, can direct a discussion and include your input on whether or not you think it was perfect or what you would have expected them to do differently. So I think those are some ways. And you can also consider having a guest speaker in your office. It's rare that people have someone specific for their front desk. Often we do things for the entire office, but you can also have someone who may be willing to just focus on your front desk staff, and that's kind of a treat for them.
Great. Great ideas.
Thank you.
Okay. We have another question. I am new to my practice and our workflows are outdated. How should I begin to tackle this?
Okay. So, I mean, generally, the work doesn't stop, right? People are still working. They're still completing their everyday tasks. But what I would do coming into a new position is pull together all of the That's a great question. I would pull together all the references and resources that your office has and everything that your front desk references to complete their tasks. And then, once you have all this, you can create a list of each task or workflow by priority. What you think is most important that should be done first, and then set a goal for completion. So if you say, okay, there are maybe 20 different things that you have to rewrite, how much time is it going to take you to get this done? Some of them obviously are shorter than others. Others are going to be, more elaborate. So you want to just give yourself a time frame to complete them and just start working on them, because if you're newer to the group, you're going to have a lot of other things that you have a responsibility for, but you want to put an end date to this so that it gets done. Because as a new addition, you're going to be very busy, but once you have these workflows ready, it will position you and your medical receptionist for a more successful future. So that's what I would suggest.
Okay, great. Well, thank you so much, Shivhon. Do you have any other words of advice or anything else that you would like to leave us with?
I think I just want to encourage everyone to be very supportive of their front desk staff. I think our receptionists have a wonderful disposition where, they can set the tone, and you want to just make sure that you're supporting them, as I said before, every step of the way, because they are going to be, and continue to support you and your clinical staff. So, just because they may not have, medical degrees, and they may not, be nurses, but they have a very, very important role, and always just recognize that, and be there to support them, because they support our groups tremendously.
Great advice.
Thank you.
Well, yes, thank you. So audience and attendees, thank you so much for attending as well. Please use the contact information on the screen for any questions to contact Shivhon directly. Or if you think of something later, please send us questions and we'll forward them on. Please remember your PACOM and your PMI CEU certificate will be emailed directly to you from within 2 days following the broadcast. So it might not be immediately, but it'll be within 2 days following the broadcast. There's no need to request it. You can also register for future webinars or request a demo of our compliance solution on our website, which is firsthcc.com, or call us at 888-543-4778. And thank you for joining us.